I just wanted to take it down back to how do we even begin going to ISO 55000, 55001 certification. There are two types of certification to ISO 55000. There's individual and there's organizational 55001 certification. So just want to clarify that. The ALN does offer professional certification designation for ISO 55001. This certification does say that the individual has knowledge to participate in and contribute to asset management efforts within the organization. So there are other certifications that are available that are out there, more focused on asset management activities such as maintenance and engineering. I know that we had spoken about those earlier in the presentation, but just kind of wanted to give you an overview as to what we're looking at. And of course, here are kind of the big level steps that you could go through in order to begin training and certifying your organization or yourselves. Again, I spoke of the individual ISO certification that you could get, the training, individual certification through ALN here. I'm part of Andrew James Advisory Group, and I know that Mike said, or actually Nick mentioned that we had our next training is going to be in November. Beyond that, leadership acceptance. I know we harped on this quite a bit. Leadership acceptance of the organization is key. So once you would decide you're going to be that champion bringing this to your leadership, there are also opportunities to have one-day leadership executive overviews of the ISO 55000 1 and 2 as well. And so they understand kind of what you're getting into and to help develop that and cement that C-suite sponsorship. From there, we would suggest that it would be more training because again, as I mentioned in the very beginning, we need to be singing from the same songbook in order to be able to implement something. We all have to know the definitions of what we're implementing, and then we have to really understand why we're doing it. And going back to ISO 55001, what must we do to get certified, those shall statements. Again, there's opportunity at that point in time for individuals to get certified through the ALN. And then really the rubber hits the road. Once you start looking at your organization, you kind of have to do that gap assessment. Where are you in your organization compared to what must you do in order to be certified through one of the certifying bodies for the organizational certifying bodies in order to be ISO 55001 certified. I'm gonna stop here and mention that there are organizations within the world, the US, that have self-certified. That is different. That is much different. It's essentially saying, yep, we've done this. And yes, you saying you've done something, of course, doesn't mean that you are certified by an outside governing certification body. So it's important that the organization understands that. And there's a decision that is made whether or not you're going to be certified by an outside body. And of course, I think the importance is that you sort of want to have both. As you can see later on, I'll say that audit is created. I would say the audit is as Frank has said, is so important. You need those individuals who are auditing, understanding what ISO 55001 is. And so, I would have those folks also introduced way early to the process within your organization so they know what's coming down the pipeline. But beyond that gap assessment, then you need to comply with ISO. And you utilize those guidelines, guidance and best practice from your ISO 55002 in order to comply with your ISO. Again, that audit is created. You need to have that ISO 55000 knowledge from your internal auditors. And then from there, knowing that you can and you have checked the boxes in order to be ISO 55001, you can invite a certification organization like ANAB to come in and certify your organization. Now, these steps take a long time. And again, we talked about culture, we talked about culture change, we talked about policies and procedures, and, Art went into a series of steps that need to happen, and that it doesn't take that. I mean, it does take a long time, and the governance of it, and then also the audit of it. So just understand that this is a process. It takes a while. I wouldn't say to ever get bogged down or sad that it's not going as fast as you want it to. It pays off in the end. And at the end of the day, the ability for you to understand that what you're doing, the work of the organization, the management of your assets, is aligning to the overall organization is very, very important. The ship needs to all go into the right direction, and this helps us do it. Again, I mentioned that Andrew James Advisory Group, we provide courses in both on-site and remote formats, but obviously right now, not on-site. We're doing COVID-19 remote offerings. And our offerings include the full ISO 55000 training courses. It's a 2-week online format. We also offer that executive overview, and then a 1-day ISO 55000 summary course as well for those people who would like a summary course. But the next class is planned for November 9th. It would go from the 9th through the 20th. That's where you could sign up. And then once you take that course, the virtual 2-week online course, then you will be able to sign up and get certified through the ALN. But in conclusion, I just wanted to go over that, again, ISO 55000, it's intended for those considering how to improve the realization of value for the organization from their asset base. It's all about value. And in healthcare, you've heard value-based care. What's the value of what we're doing? This is very, very big right now. And it is important to what Michael said. I would rather have us focus in on the asset side and optimize that and take cost out of that than have to do a reduction in force and to really affect the bedside care, because that's not what we want to do. I'd rather have the right asset at the right time in the right condition. The adoption of ISO 55000 worldwide is increasing. It's time for healthcare to lead instead of follow. A lot of times, and I've been in healthcare over 20 years, so I can say this, a lot of times we follow. We were late to Six Sigma, we were late to Lean, we were late to a lot of other methodologies, performance improvement methodologies. And in this case, I think we can take this methodology and really strengthen the organization and do the right thing for the hospital and the hospital system. And at the end of the day, we're making sure that patients have the right care with the right equipment. With the continuing environment of cost and regulatory pressures, that is never going to go away. We've had it for decades. This will provide a framework and methodology to reduce that risk. And again, reduce the risk of from not only an internal audit risk, but then you're talking about even patient care risks, because let me tell you, I've seen assets in there that should not be working on patients. I've seen it. I've seen it in the US. I've seen it overseas. So this will help us align those assets and really look at those asset life cycles and align them with the strategic goals and objectives of the organization.